Hi, on this presentation, I will be educating you about specific phobias. Understanding the definition. Specific phobias are an overwhelming and unreasonable fear of objects or situations that pose a literal danger but provoke anxiety and avoidance. Unlike the brief anxiety you may feel when giving a speech or taking a test, specific phobias are long-lasting, cause intense physical and psychological reactions, and can affect your ability to function normally at work, at school, or in a social setting. Specific phobias are among the most common anxiety disorders, and not all phobias need treatment. But if a specific phobia affects your daily life, several therapies are available that can help you work through and overcome your fears, often permanently. A specific phobia involves an intense, persistent fear of a specific object or situation that's out of proportion to the actual risk. There are many types of phobias, and it's not unusual to experience a specific phobia about more than one object or situation. Specific phobias can also occur along with other types of anxiety disorders. Some fears. Situations such as airplanes, enclosed spaces, or going to school. Nature, such as thunderstorms or heights. Animals or insects, such as dogs or spiders. Blood, injection, or injury, such as needles, accidents, or medical procedures. Others, such as choking, vomiting, loud noises, or clowns. No matter what specific phobia you have, it's likely to produce these types of reactions. An immediate feeling or intense fear, anxiety and panic when exposed to or even thinking about the source of the fear. Awareness that your fears are unreasonable and exaggerated, but feeling powerless to control them. Worsening anxiety as the situation or object gets closer to you in time or physical proximity. Doing everything possible to avoid the object or situation, or enduring it with intense anxiety or fear. Difficulty functioning normally because of the fear. Physical reactions and sensations, including sweating, rapid heartbeat, tight chest, or difficulty breathing. Feeling nauseated, dizzy, or fainting around blood or injuries. In children, possibly tantrums, clinging, crying, or refusing to leave a parent's side or approach their fear. The causes. Much is still unknown about the actual cause of specific phobias. Causes may include negative experiences. Many phobias develop as a result of having a negative experience or panic attack related to a specific object or situation. Genetics and environment. There may be a link between your own specific phobia and the phobia or anxiety of your parents. This could be due to genetics or learned behavior. Brain function. Changes in brain functioning also may play a role in developing specific phobias. Specific phobia risk factor. Your age. Specific phobias can first appear in childhood, usually by age 10, but can occur later in life. Your relatives. If someone in your family has a specific phobia or anxiety, you're more likely to develop it too. This can be an inherited tendency, or children may learn specific phobias by observing a family member's phobic reaction to an object or a situation. Your temperament. Your risk may increase if you're more sensitive, more inhibited, or more negative than the norm. A negative experience. Experiencing a frightening traumatic event, such as being trapped in an elevator or attacked by an animal, may trigger the development of a specific phobia. Learning about negative experiences. Hearing about negative information or experiences, such as plane crashes, can lead to the development of a specific phobia. Specific phobia complications. Social isolation. Avoiding places and things you fear can cause academic, professional, and relationship problems. Children with these disorders are at risk of academic problems and loneliness, and they may have trouble with social skills and their behavior significantly differ from their peers. Mood disorders. Many people with specific phobias have depression as well as other anxiety disorders. Substance abuse. The stress of living with a severe specific phobia may lead to abuse of drugs or alcohol. Suicide. Some individuals with specific phobias may be at risk of suicide. Prevention. If you have a specific phobia, consider getting psychological help, especially if you have children. Although genetics likely plays a role in the development of specific phobias, repeatedly seeing someone else's phobic reaction can trigger a specific phobia in children. Conclusion. I hope these slides have educated you about the understanding of specific phobias. There are multiple different kinds of phobias, but I just went over a few of the big ones. Although we don't have the exact source of specific phobias, we at least know that it's very common in people. It's so common that half of the time, people don't even realize they have one. After researching this topic, I found out that I have a few myself that I didn't even know were phobias. Take that into account and self-evaluate yourself. Do you have a specific phobia? Citation page. Thank you.